This month, changes go into effect impacting first responders who leave the profession on something called duty disability.
It can range from a physical injury to PTSD, and a historic number of officers have left their jobs for mental health reasons in the last few years, sparking debate and prompting new legislation at the Capitol. WCCO's Jennifer Mayerly walks us through the changes and the reactions.
The impact is to those who protect and serve. First responders communities rely on and the cities who employ them.
We want Minnesotans that keep us safe to be kept healthy.
Senator Nick Frentz authored the bill in the Senate.
First difference is that we're providing 24 weeks of treatment for the men and women that keep us safe. That means cutting edge treatment for PTSD to try to help them recover.
Frentz says first responders would stay on the payroll during that time, and only after the treatment are they able to apply for duty disability, with the hope some will stay on the job after getting help. It also helps cities cover the cost of health insurance if someone goes out on duty disability.
The provisions in the bill that reimburse cities and counties for the health care costs is a crucial plus, especially for mid-sized and smaller communities, where even 1 or 2 claims of 30 years of health care expenses can be substantial.
A retired Minneapolis police sergeant opposes what was passed.
It's going to hurt a lot more first responders than it's going to help.
Chris Stewart went out on duty disability for PTSD. He says the mental health provisions don't go far enough or have enough safeguards.
If they wanted to make this effective and efficient and helpful, they would have offered this mandatory treatment parameters as optional, as given them given the first responders an opportunity to participate in this treatment, because a lot of them would.
Instead, Stewart feels what was passed will only worsen the problem.
It's going to force people back into the closet. It's going to force people to kind of suck it up and not deal with the mental health issues that we've been trying so hard to raise awareness for.
And he calls PTSD a lifetime injury.
These are lifetime injuries. These are lifetime disabilities. And you will never be able to go back to the position that you left.
The League of Minnesota Cities, who lobbied on behalf of 855 communities, says the new law will help them.
There is significant funding in the bill, much of which will come back to employers, but that will save taxpayer dollars at the local level when these incidents occur.
Ann Finn says a lot of effort went into the bill with the goal of preventing mental injuries and then caring for those who do suffer from one.
We know that not every person who is injured will come back to work or can, but we think that too many have left without getting the help they need to be able to even evaluate whether they want to continue in their profession.
While she realizes not everyone is happy with the bill, she does hope people don't rush to judgment.
I hope they'll be open-minded to giving the legislation a chance. A lot of effort went into trying to get it right.
Jennifer Mayerly, WCCO News.
There have been a lot of questions about the reapplication process. Para, who manages the fund, says some clarifications were made, but there's no change. We have more information on our website, WCCO.com.